Good day to Associate Professor Dr. Lim Eng Lee. Today, myself, Kathirevan, and my groupmates Amreen, Arhana, and Firdaus will be presenting about intravenous therapy.
Intravenous therapy is essential in modern medicine, allowing fluids and medications to be delivered straight into the bloodstream for fast and reliable treatment. It is commonly used in emergency surgeries and for patients who can't take fluids orally. Although it looks simple, IV systems rely heavily on fluid mechanics. In gravity-fed setups, fluid flows under hydrostatic pressure, and factors like tubing diameter, viscosity, and elevation height all affect the flow rate. We apply key principles like the Hagen-Poiseuille law and Bernoulli's equation to model and understand this behavior. Our report examines how these parameters influence pressure and efficiency, highlighting how engineering theory directly supports safe and effective IV therapy.
The following problem is used to determine the required pressure in an IV bag to deliver 500 milliliters of saline solution over 2 hours, considering the tube dimensions, vein pressure, and fluid properties given.
Now, let's go through the methodology, which will cover the fluid mechanic concepts used and the assumptions made during the calculation. So, the key concepts used are the continuity equation to calculate the volumetric flow rate, the Reynolds number to determine laminar or turbulent flow, the Darcy-Weisbach equation that is used to determine the head loss due to friction, the general energy equation that calculates the pressure drop, and rho GH is the hydrostatic pressure principle that is used to validate the results. The assumptions made are such as the flow of saline is laminar, steady, and incompressible. Tube has a constant diameter with fully developed flow over the total length of 2 meters. No pumps or turbines used, so it is entirely gravity-fed. The reference elevation is set at z equals to 0 at the patient's medial cubital vein exit, and the fluid properties are constant at 25 degrees Celsius with a density of 1005 kg per meter cube and a viscosity of 1.07 times 10 to the power of negative 3 kg per meter second.
There are several steps involved in solving the problem that we discussed just now. First of all, we need to find the volume flow rate. Using the formula, we'll get the value of 6.94 times 10 to the power of negative 8 meter cube per second. Next is finding the Reynolds number to determine the flow time. So first we find the V average, that is 0.0393 meter per second, and then substitute that into the formula for Reynolds number. We get the value of 55.39, which is less than 2,300, which indicates the flow is laminar. The third step is to calculate the frictional factor, which is 1.16, and also the head loss, which is 0.01218 meters. The next step is to calculate the pressure drop using the general energy equation. Since there are a few parameters that can be cancelled out, we use the formula as shown below, and the calculated pressure drop is 17.63 kilopascals. The final step is calculating the pressure in the IV bag, which equals to 84.67 kilopascals. We can calculate the pressure drop as well using the simple hydrostatic concept, which gets us 17.75 kilopascals. The percentage error is 0.68%.
Hi, I'm Syazwan, and I'm going to talk about the discussions. The calculations and theoretical analysis presented in this assignment highlight the critical role of fluid mechanics in the design and the operation of IV therapy systems. By using Hagen-Poiseuille and Bernoulli's principles, we can predict the behavior of the flow, and it ensures efficacy and safety in the tubing system in a clinical practice. The calculated Reynolds numbers is lower than 2,300, which confirms that this is a laminar flow. Laminar flow is important in this tubing system as it ensures predictable fluid delivery and minimizes turbulence and mechanical complications. This is important for dosing accuracy. Friction factor is consistent with the expected laminar flow, and the head loss is relatively small. This means that the gravitational force is the dominant force in this system. The pressure drop, which is only 70.63 kilopascal, closely matches the pressure estimated using the simple hydrostatic formula, which means that the simple hydrostatic formula can be used for quick clinical estimates. Precise control of IV flow rates is essential to avoid complications such as fluid overload, electrolyte imbalances, or inadequate therapeutic delivery, as even small changes in tubing diameter, length, or fluid viscosity can affect the flow rate. While the calculations assume steady, fully developed laminar flow and constant fluid properties, lower conditions may introduce variability, such as pressure movement, kinks in the tubing, temperature changes, and variations in venous blood pressure, can all influence flow. In addition, different types of fluid, like blood or lipid emulsions, have distinct viscosities and may require adjustment to system parameters for optimal delivery. The discussion also recognizes the growing importance of sustainability in biomedical engineering. The widespread use of disposable IV bags and tubing contributes to medical waste, prompting the research into reusable and biodegradable alternatives. However, any new materials must be rigorously evaluated for their fluid mechanical properties, such as pressure resistance and flexibility, to ensure they do not compromise patient safety or system reliability.
In conclusion, this report showed how fluid mechanics helps ensure accurate and safe IV therapy. We confirmed that the flow is laminar and predictable, and our calculated pressure drop closely matched the hydrostatic estimate. These findings highlight how small design factors can significantly impact flow, reinforcing the importance of precision and sustainability in biomedical engineering.